Hello, Dr. Vikki Petersen here. I've been receiving a lot of questions regarding corn and is corn gluten and is rice gluten, and there's been a lot of chat about these various other grains on the internet. So I wanted to clarify this issue for you. The problem really began when we started calling gluten, what we know as gluten, because the truth of the matter is that corn does have gluten. Not the gluten you're thinking about, but and so does rice. So there's rice gluten, there's corn gluten. It's kind of a problem of nomenclature or the way we describe something, because we really should be saying gliadin when it comes to the protein found in wheat, rye, and barley. And for that matter, there's several aspects to the protein. So the wording is incorrect, but the truth of the matter is we're stuck with this wording. And so we shouldn't be confusing each other by sort of playing with that wording and getting people upset and, as I said, confused about what to eat. So whether it's right or wrong, we use the term gluten, and it's used worldwide to distinguish the grains that those with celiac disease, those with gluten sensitivity, are intolerant to eating. So that is wheat, rye, barley, and the derivatives of wheat, things like farro and spelt, and there are some others. So that's our nomenclature. That's the word we're using to describe it. So let's stick with that. Now, as I mentioned, corn does have a corn gluten, but it's not the same gluten that's found in wheat, rye, and barley. So that's where the confusion is coming from, is just throwing out this word gluten when we all have, a somewhat incorrect definition, but at least we've all agreed on it, that we're talking about wheat, rye, barley, and those other grains I mentioned, and as it relates to someone who is gluten intolerant. So then the question is, if corn is okay and something like buckwheat is okay, and oats are okay, meaning they're not true gluten by our previous definition, then why is it that some people do poorly with them? So that's really the crux of the matter that I wanted to address today. And in a perfect world, I have you all come visit me, and I have testing, and we have a controlled environment, and we could really figure out what grains are your friend, what grains are not your friend. And I believe, based on working with patients for so long, that while there is gluten intolerance, certainly, and that I include both celiac disease and gluten sensitivity, there are also just people who don't tolerate grains very well for various reasons. So, as I said, in a perfect world, we would do testing. We'd find out if you were gluten intolerant, whether it's celiac disease or gluten sensitivity. We'd find out if you had any cross-reactive foods that aren't gluten, but your body thinks are, because your immune system is depressed and is having trouble making the distinction. And we could really find this out very easily. But it's not a perfect world. You can't all come see me, although many of you do, and I love that. So what should you do? So number one, find out if you're gluten intolerant. Try to get testing as the first order of business. If you absolutely can't, or the test comes out negative, because there's a lot of false negatives, then put yourself on a 30-day gluten elimination diet and see how you feel. If you really notice a marked change, which so many people do, then that's good enough. That test that you did on your own that had no charge to it is considered a valid test. So you can then go forward with that knowledge. So then if you're moving along and you've been gluten-free and you're being very good about it, and you're better, but you're not as good as you want to be, then you can start looking at some of these other grains. The good news is you don't necessarily have to be away from them for the full 30 days the way we require with gluten. You can usually do a couple of weeks, and that's enough. So you could take corn out of your diet for 2 weeks. And remember, there's a lot of places that corn sneaks in. It's not just eating corn on the cob, but there's cornstarch and corn syrup and high fructose corn syrup, and none of those things are very good for you. And it's, what is it, close to 90% of all the corn in the U.S. is genetically modified, which is a whole nother issue, which makes it not one of my favorite foods. But do your best and really, really eliminate it for 2 weeks, and then challenge yourself, and challenge yourself with the real thing. Corn, like corn on the cob or frozen corn. And if you can get it non-genetically modified, that would be great. It does exist. It's just not that easy to come by, and it'll say that it's non-GMO. That's what you're looking for. And then see how you feel. Have a good portion of it. The way we challenge is we have somebody have a serving twice in a given day, and then see how you do that day, and then the day after and the day after that. So it's about a 3-day trial. You only eat it on day 1 and you eat it twice, and then you don't eat it on day 2 and you don't eat it on day 3, but you're watching to see how you do and see how you feel. So that's the proper way to reintroduce. And then if you feel you're fine, great, carry on, and then you can try it with the other grains that you might be concerned about. It's interesting how the body will, when you're treating it well and it's starting to feel better, it will communicate. It will tell you how it feels. And on the flip side, when the body's very toxic and very ill, its communication is pretty bad. The analogy I use with patients is that the water is so muddy that when you add some more mud, you can't tell. So you have to get to that point of sort of moving in that right direction. So if you're gluten intolerant and you're eating it, it's not going to be easy to find what other grains or other foods you're sensitive to. So you'd have to do the gluten first, because that's the biggest, baddest one, and then get that out of your system, let your immune system repair a bit, and then you can start looking at these other ones. Testing is always available to you, and I'm happy to help. But I just really wanted to clarify this question, because I've been inundated this week of, what do you mean corn is gluten, and what do you mean rice is gluten? So it isn't in the form that we discuss it, and that's not to say that some people don't do poorly with other grains, but it doesn't mean you're eating gluten in the sense that we mean when you're gluten intolerant. So I hope that cleared things up. Please let me know, and I do love hearing from you and getting your questions, so give me feedback on this, and please let me know how I can help you and those you care about. All right, so until next time, I wish you very good health.